Prop 64 has had a horrible impact on patients who rely on cannabis in the state of California. Before 64 was passed in 2016, we relied on Prop 215, which was passed, ironically enough, by Air Force veteran, helped pass by Dennis Perone. And in 1996, he bought us medical cannabis. And that allowed patients who had a medical rec, to access cannabis, grow cannabis, participate in the cannabis community as a medicine. And that was the beauty of Prop 215. That dramatically changed because Prop 64 made cannabis about two interested parties. The government, via tax coffers, we promise huge tax revenue increases to both local communities and the state, and the small oligopoly of license holders, which as of today is 850 retail license holders in a state of 45 million people. To give you an example, Colorado has 1,100 licenses for 5.7 million. We'd have to have over 10,000 retail licenses just to equate the access from a brick or mortar perspective that Colorado sees. So you can imagine the total destruction of access that has occurred under Prop 64 geographically, since 70% of the state does not have access, and two, cost. As I said, a veteran has 100% disabled veteran gets $3,000 a month from the VA. If they are to medicate with cannabis, just 3 joints a day, that's an eighth of cannabis flower. At $40 for each eighth, it's about $1,200, or 40% of that disabled veteran's income they have to spend in the legal market to choose cannabis. Should be no wonder why the illicit market is burgeoning, blowing up, and is going to continue to blow up under this tax and regulate monstrosity that the government and some in cannabis have given us. Ironically, we were given adult use, and we took what was legally available in 100% of the state and took it down to 70%, give or take. There's some different interpretations. That's 70% of the state. You can't access legal cannabis in, period, end of story. In California in 2022. Truly mind-boggling. People are okay with it. But this is the irony of the whole thing. It's because of local control, the NIMBYism in California. And when we look at this, the problem we're running into is they don't have control over anything. They're not stopping cannabis in the communities. They're only ensuring the illicit market, the traditional market, the black market, whatever you want to call it, exists and is vibrant. Black market prices have gone through the roof. That's attracting participation. We are not going to stop the black market until we do one thing. We deliver access, legal access to the state citizens of California who have demanded it for decades, and say that only comes through one thing. The alcohol model, we don't have an illicit market for alcohol in California for 2 good reasons. It's geographically available. That goes to your 70%, but it also is affordable. And that goes to economies of scale. One of the big things and problems with the limited licensing models is you don't create the economies of scale in the supply chain to drive down pricing, and you also don't have a healthy competition to drive down pricing. So access is 2 issues. Geographically available, which is the 70% no access in California problem, but we also have a cost issue, and that bleeds into the cost issue because it prohibits the important economies of scale and competition needed to provide access the consumer wants. It's something we call the free market in America. It's something we do very well. We're distorting it with this monstrosity, Prop 64. SB 34, for those people who don't know, is when Prop 64 became the law of the land. Not only did the supply chain no longer need patients to grow, they needed a license. The real problem with donating cannabis in a regulated market like the track and trace that we use is the government feels if you're giving away cannabis, they're not getting tax revenue. And investors love the idea of helping, but they also would rather sell cannabis than give it away. So SB 34, what it did was take the cost, incremental marginal cost for donating cannabis, because you still had to pay taxes even if you're giving it away for free. And that basically killed the donation market from an economic standpoint. And from there, removing the taxes opened up with the regulatory format that the DCC has put forward to allow the supply chain to donate cannabis to patients, anyone with a medical rec. how we were instrumental in fighting for that is we were loud. We turned out numbers, literally into committee. We were never politically active until I want to say it was 2017. And Katie Maple, who was a lobbyist at the time for delivery companies, was fighting a local delivery ban pushed by the League of Cities, one of the unions, and some license holders who viewed delivery as competition. And literally from there, we walked into committee where it was being heard with about 100 vets. And Kevin, 6'4", 240 pound. We had a lot of scary dudes and girls. And I think we intimidated a lot of people, but it was that power of numbers walking in, speaking truth to the legislature and letting them know we're going to highlight their vote to our communities that got that bill killed. And it was literally from there we recognized the power the veteran community had if wielded for righteous causes. And so when SB 34 came along, we pushed people and pushed veterans and pulled veterans, and veterans pulled us to really make a turnout. And we would show at committee, we were showing 100 plus veterans lined up to talk about why SB 34 was important to them. But SB 34 was passed prior under its previous nomenclature. And that was when Jerry Brown was governor. And his last act on cannabis as governor was letting the past legislation that we passed, I believe it was 2018, expire. If it doesn't get signed by a certain date, it's automatically vetoed. And he let it be vetoed. And that was actually an introduction to the pragmatic reality of what cannabis is in the political realm in California. And Senator Wiener asked, he said, what do you want to do next year? And we said, we want to fight. Let's introduce it again next year. And Senator Wiener, true to his word, introduced it again next year. And literally from there, we did the whole, shebang again. A little bit lonelier, I think. There's a lot of people we saw in the first go around that weren't around, but we stuck to it and we shepherded through committees and got a lot of Republican support and no votes. It was, not being very nuanced on matters. Mark and I we'd walk veterans into these senators and assembly members' offices, and they would literally go yes, and we'd tell them who we were, and we'd have people from their jurisdiction, and we would say that we need support and help and who we are and why. And they would always give us lip service. Thank you very much for your service. And, well, my senator or someone is not sure. And we would just go, well, listen, we're going to make it real simple here. We're going to highlight that vote in your community. And if it's a vote against access, and again, that is contributing to the suicide and overdose epidemic, we're going to highlight that in the community. And we're going to send out veterans in front of your offices. And it worked magic. And we got a lot of people who were going to vote no to not vote anything at worst case. And I think we passed it by far to this day. I think it is the most, if it isn't, no one's told me, I think it's the most lopsided cannabis victory in the state of California in terms of people voting for it and not voting against it. And that we got passed. And ironically enough, even when we passed it the second time, a lot of people in industry and us said it's going to get vetoed. No, they're not going to be for it because, again, they don't want to give away free weed, and they definitely don't want to give away, their tax revenue as they see it, and corporate sees it as an expense line. And so, interesting enough, when Jerry Brown was governor, we got invited to a fundraiser for Governor Newsom when he was lieutenant governor, and we took him up on that, and we showed up with, I think there was 6 of us, 6 veterans. And we showed up at this $10,000 a plate location in Los Angeles in raggedy, coat and tie. And someone thought it was a good idea to ask the first question of the governor. So they said, raise your hand. I raised my hand and they said, Sean. And I don't know if it was on purpose. I think they probably regretted it later. But I asked then Lieutenant Governor Newsom what he would do regarding Prop 283 at the time, or Prop 289 at the time. And he said, well, first, let me say it was unintentional, the destruction of access that's occurred under Prop 64, and that we needed to fix that, and that he would absolutely sign this compassionate bill when reintroduced if Governor Brown vetoed it. And he didn't know what Governor Brown would do, which probably did know. And they had asked no one to tape it. We believe they actually had some electrical interference, but one of our vets who's experienced in comms and knows how to handle this stuff taped the whole question and his answer and me being in the picture. That came back to, I think, save us. And literally what ended up happening is after it got passed in 2019 and pushed through to the governor's desk, it was the weekend coming up was when it was going to expire. And if he didn't sign it, it was going to be vetoed. And they're begging me to contact, at that time, Nicole Elliott and let her know that, it's important for veterans and that this passes and why, and to use the video. And I, to this day, believed that Governor Newsom was going to stay true to his word, so I didn't feel the need to. But I did send it because I thought it was very heart-wrenching to Nicole Elliott and said, we look forward to the governor fulfilling his word and signing SB 34 at the time. It means everything to veterans, and we saw it. We were playing it at one of our chapter meetings, and it brought tears to the veterans' eyes, knowing that help was on his way. And I think that next couple of days it got signed. And so I like to believe the story that Governor Newsom was going to sign it all along. I like to believe the story that what he said, admitting that the destruction of access under Prop 64, he was sincere. And so, yeah, I thank him for signing that. And SB 34 so far has been a wild success. But I think it's important when we look at this, it doesn't change the systemic issues with Prop 64. We're going to help 1,500 patients, I believe, in May, approximately, maybe more, access cannabis. There's 2 million veterans in the state of California. There's millions of more non-veteran patients who want to use or could use cannabis as a substitute for opiates and other dysfunctional medicine causing and wreaking havoc in our communities. And that's not going to happen, no matter how healthy SB 34 is. And so we need to really look at the model we put forth and say, is this the best we can do? And it's not. And I think that's why we're fighting for a further proposition, cannabis reform. And we plan on bringing that to the voters, and that's freeing the weed for the people. That's what people don't understand. There's a tremendous amount behind the scenes with SB 34 that makes it hard to be consistent. And we're trying the best we can, but SB 34, you need a licensed retail who's willing to put it on. You need medicine that's available. And there's a lot of different motivations for donating meds we can get into. But more importantly, you need a distributor that is to deliver the meds, and you need patients to come get them before things expire. We are really good on the patient side. The credibility we bring on the patient side, the cause that we advocate for is very relatable. But there's only so much we can do. So we run into problems when, we've had dispensaries with staffing shortages. So once a month has gone to once every 3 months. We have, medicine that was 1 or 2 times in nature, meaning expired lots. We get a lot of flour that is expired. Ironically enough, flour doesn't expire, but our regulations basically prevent flour from being sold after the year. You have to retest it. We've done that. The problem with retesting large amounts of flour isn't the cost. It's the cost and time associated with relabeling tens of thousands of units. But you can see we have to work within the regulatory environment. The positive is the regulatory environment is creating some honey spots. And what I mean by that is, for example, Glass House has been donating a tremendous amount of their flour to the veteran community in Southern California, and we're going to move that up north too. And that's mainly because they have an oversurplus of it, and it's expiring. So if they don't get it out for a donation, they've got to destroy it. So what we're finding is those sweet spots where we can go in and get meds and say, instead of spending tens of thousands of dollars to process and destroy perfectly fine medicine, let's get it out through the license holder. So it really takes a team effort, and it takes, the stars to align. So there's a tremendous amount. The more people we help, the more screams we hear of need. And that's the saddest part of this. And I think it's really important to people to understand is we're helping who we can, and we have a platform, but this is not going to help the vast majority of Californians. It just can't. The numbers are too great. Really, what we're trying to do here is represent who we are, and that's our brand. And some people don't understand when I use the term brand, but it's really important. You support a brand because you believe in what they're about, or you believe what they do, or you want to help for whatever reason, right? Your brother's involved, your sister's involved, you want to help vets, or just at the end of the day, you like our messaging. And so it's really important to us that we stay at the forefront of fighting for access, as long as access doesn't exist for our brothers and sisters. And access doesn't exist under Prop 1664 for too many of not only veterans, but again, non-veteran patients. And so one of the forefront things we're doing is we're going to stay active at the state legislature, passing bills like SB 34, and when we fail, come back the next year and pass more. So for an example, a bill, SB 1186, that Senator Wiener introduced this year, would guarantee medical delivery of medical cannabis anywhere in the state of California. It would be the first foothold against local control in the state. We had a few objections to the wording when it first came out. We worked with the senator, got the wording switched, just a much simpler bill, and it guarantees medical access of cannabis to medical patients in the state of California. If we can't get the legislature to agree on that, we've got bigger pictures. So part of it is one part, fighting for what's right in hopes we can get it passed. The second part is fighting for what's right, because there's no better platform to highlight what's wrong. And so we're going to continue down that path, yearly being involved in the legislative process, calling out what we're against, and hopefully getting some of these bills passed. I mean, 1186 wasn't supposed to get out of committee. It's out of 2 successfully so far. And we're hopeful that at least it will get heard. I don't know if it's going to pass, but we're going to fight for that. But the bigger issue, as I said, it's a systemic change. As many people as we help, Prop 64 is the antithesis of equity, meaning you have a limited number of owners and a limited number of participants who's rationed based on cost. And so, like too many markets in California and too many economic ecosystems in California, they exist for the rich to invest in and the upper middle class rich to participate in. But what it doesn't do is deliver healthcare or medicine or an alternative to pharmaceuticals very well to those people who can't pay overpriced prices for the benefit of taxes, for the benefit of unions, for the benefit of funding environmental groups, for the benefit of all the people who seem to be at the table, not delivering functional policy to the vast majority of Californians. And so we're going to continue fighting for that. And how we're doing that systemically is not just through the legislature, but calcannabisreform.org. Cal Cannabis Reform is an entity we set up, a California nonprofit, and we paid the legal team responsible for Prop 19, which was adult use that failed in 2010, to work through a fix to Prop 64. And so we're pushing that right now, trying to not only engage the community, but look for funding that would basically turn cannabis into a much more free choice, free market event with low taxes that would go to help the very communities that are on the front lines of the war, not just exploit them, but actually use the tax revenue to invest in schools and secondary education, increase funding for the environment, and we believe what we put forward will kill the black market, the traditional market, and at the end of the day, that is what everyone's promised and no one's delivered. So that's our goal, is to kill the black market. Because once you kill the illicit market, the traditional market, that means the participants who are blocked out now are participating, the consumers who are now in the illicit market are participating, and the government's probably making more tax revenue because 80% of the market is not untaxed in the illicit market. It's 100% taxed in the legal market. And we can do it. We did it in alcohol. We can do it in cannabis. One of the important ways we're fighting for access to is through messaging. We're about to start a billboard campaign talking about the science about best public policy. And the data behind best public policy is policy that drives suicides lower, that drives overdose lower, that drives harder substance abuse lower, because cannabis is a substitute. The numbers coming out, just published this year from UC Davis, Yale, and in the British Journal of Medicine, showed where cannabis dispensaries exist, the greater the number, the lower the number of opiate deaths. Access is saving lives. And that's the message that this is all about. It's the foundation of what we do. It's the foundation of why we provide free cannabis, because disabled veterans cannot substitute legal cannabis. It is out of their economic ability, let alone their geographic ability, because 70% of the state does not allow legal access. How do we grow that help? So instead of feeling like the kid with his finger in the dike, we're making a material difference in our patient's life in terms of access. And I think that's the key question. I think what we've come down to is we need to take the brand we've created by being true to what we're about, the credibility we built, and now try to bring that into the legal market and provide a platform by which the legal industry, consumers, and the supply chain can help us. And so that's what we're doing with Weed for Warriors Cannabis. Think of it like a Newman's Own, Ben & Jerry's, compassionate capitalism, where we then take the monies, not only fuel our activism, not only fuel the legislative attempt in other states to bring SB 34 to other states, but more importantly, provide medicine. So in a lot of these locations where you have to spend money to get medicine still to the patient, if we're selling, product, and for every 10 half ounces we sell, we're able to put 1 half ounce in a patient's bag every month at our SB 34 events. That's a win. And that's what we're aiming to do. And you've already seen that. We put RSO in our patients' bags. We put tincture in our patient's bag. We've got flour in our patient's bag. And we're just touching the surface. So, this is about everything we're doing and amplifying it through what makes America great. And that's the market, and let people vote with their pocketbook. And we believe we can bring the change needed better than anyone. And we think we're doing that. I want to take 2 seconds to really give a shout out to everybody who's helped in SB 34, from the group that helped fight for it, some of the characters we are working with today, like Sweet Leaf Joe and Senator Wiener's office, to more importantly, the supply chain, the distributors, the brands, and especially the retailers who are coming and spending money because they're paying for their employees to bring and intake everything, but more importantly, to give it out to the veterans. A huge thank you. It is a beautiful thing to see, and it's a beautiful platform that we can provide that we hope touches on some part of innocence and purity, and we're trying to maintain that. So if you like what we're doing, please support those people who support us, and that's to the veterans, but not only the veterans, consumers. Go to those dispensaries who are supporting us, use those brands that are supporting us, and really use your pocketbook, forget about us, to really start making a vote to change how we act on the corporate side and drive the help and the marketing dollars towards compassion. And that's the only way we're going to make this as big as we can, by really letting everybody know that there's a win-win-win in it for everybody. And so thank you. And please support those people supporting the veteran and patient community through SB 34. Just want to give a big shout out to all the veterans showing up and just saying the community we're building is awesome. Where we fall down, we're going to get up and be real. But at the end of the day, we're going to stay true to access. That's what this is about to us. It's about access. It's about the availability of cannabis to use as a substitute to big pharma, the VA's opiates, the VA's psych meds, both of which come with FDA stated risk of addiction, overdose, and suicidal ideation. Is there any wonder why we have a suicide and overdose epidemic? There isn't for those of us on the front lines. And we're here to help you. You're helping us. Let's get cannabis into the community, because where cannabis is available, guess what? Suicides are lower, overdoses are lower, and that's the science. And at the end of the day, it's not even a medicine. It is a safer alternative. It is our Narcan, and we deserve a right to use it. We deserve a right to access it. It's a human right. And the need of government's tax revenue and the need for corporate cannabis to get outsized gains, to pay for those outsized promises they made the investment community, should not trump our right to life.